Hi everyone, I'm Bill Riley, and on behalf of all of us here at Medical Advantage, thank you for joining us today for our session around dashboard reporting for FQHCs. Before we get rolling, I want to cover a couple of housekeeping items. We've got all the phone lines muted currently, but we are going to pause towards the end and take some questions. So if you think of a question, please use the little chat bubble in your GoToWebinar control panel, and we'll get to as many questions as possible. Let me introduce our panelists for today. First of all, Bailey Sutherland. I think many of you on the line know Bailey already. Bailey is one of our lead consultants and account managers, a main point of contact for so many of our clients. Very tuned into the needs of the market, and specifically for FQHCs. Bailey's going to help us represent the voice of the market or the voice of the customer during our session today. Jim Stevens is not on the line with us at this moment, but we're going to go to Jim in a minute for a demo. Jim will actually take us through the different views and different screens in the dashboard itself. Jim and his team, let me just talk about him for a second. His team provides analytics support and reporting for so many of our clients, whether it's physician groups, ACO clients, quality measures, submitted claims, patient data, whatever it is. Jim and his team are touching a ton of data every month. In a past life, Jim has many years doing analytics for a big payer, so he kind of has both sides of that, the payer view, the provider view. So we'll come back to Jim in a second. And then finally, Darline Reda is our Vice President of Population Health Strategy and Solutions here at Medical Advantage. All of our larger initiatives with payers, large health systems, most recently the state of Michigan Department of Health and Human Services for analytics related to COVID testing across the state, all led by Darline. Like Jim, has several years working in healthcare value analytics with a payer, one of the Blues plans. In addition to all that, she's currently an assistant professor in the program in public health at Michigan State University, the mighty MSU Spartans, for those of you who are Big Ten fans or alumni, and previously was epidemic intelligence service officer at the Centers for Disease Control. So welcome, everyone. I should also mention that Meredith McKay will also join Jim for our demo in just a minute. Meredith is another one of our consultants, account managers working together with Bailey. Again, I'm Bill Riley. I'm a member of the marketing team. Before we get into the content, before we go to Bailey, let me do a quick introduction of Medical Advantage. We're a part of the Doctors Company. We fit under the umbrella of the TDC Group. The Doctors Company is the largest physician-owned medical malpractice insurer in the country. We have roughly 100,000 physicians insured nationwide with over $6 billion in assets. TDC consists of different business units. Medical Advantage is the subsidiary, the only subsidiary not in the professional liability space, but providing a range of consulting services for providers, groups, specialties, including FQHCs at the point of care. And we'll get into this starting next with Bailey. So Josh, why don't we go to the next slide? Bailey, let's start with you. We've supported FQHCs for quite some time now. You've been at the forefront of quite a lot of that. So can you take us through some of this history?
Absolutely. So about 5 years ago, we really dove into the FQHC space head first. We first started out really in the EHR services realm. So a variety of FQHCs had came to us and said, hey, we really are struggling with using our EHR in the best way. It's not really set up for us as an FQHC. Our reporting doesn't look the way we want it to. And we took on that challenge and helped them really clean up their EHR, optimize their workflows, and help them better report out for quality. Outside of that EHR, our services, we've done a lot of other things for our FQHCs. We've helped with EHR selection and go live. We've helped with training, helped us support practice operations, so helping them kind of just determine the best ways to do a variety of things within the organization. And since we've worked with them, we've really found partnerships across the country with many different FQHCs. While all of you guys have similar goals and hopes and things that you're required to do, you all do have your individual needs that need to be met, and we are a partner along the way to really help you get where you need to be.
Okay, great. So as we work towards taking a look at our dashboard, let's talk about some of the challenges or opportunities depending on your perspective. Bailey, and we'll stick with you, right? FQHCs are required to submit very specific reports. We see over time these are typically done manually and require data input or sourcing of data from different systems. So can you talk a little bit about what we see in this area?
Absolutely. So the biggest thing I think here in the middle, you'll see that UDS reporting is highlighted. We know every FQHC lookalike has to report for UDS, and it's a big undertaking every year. It takes a lot of manual labor hours typically for your analysts, for your staff, pulling together everything from population data to clinical data, demographics, really just, even financial data for the institution. So pulling all those pieces together usually takes a team of people, oftentimes months to get this data right. And sometimes it doesn't even match up right with what you thought you've done all year. So that's a big piece. It's definitely a challenge. It takes people out of their normal daily job duties. And if you're not keeping up with it throughout the year, sometimes you're in for a surprise and even more manual work at the end of the year to make sure you're getting credit where credit is due. The other sections here, really the funding by grants, that's a huge component as well. We know, outside of your government funding and your funding that you get through your claims that are sent out, your grants are a big portion of how you get money for new equipment, additional bodies, helping you run your organization successfully at the end of the day. And typically those grants come with stipulations on what you need to report out. So that might be, tell me how many patients of a certain sex, religion, race, ethnicity, who have a specific condition. So very, very targeted, opportunities there where they want you to report out the improvements you've made for a specific sector of your patients. So that's definitely something that, again, takes a lot of time. Oftentimes is either due out to the grant agency on a monthly or quarterly basis. And again, that time spent and the specifics of what you're looking for there oftentimes is not easy to come by in your EHR directly. So that's kind of where this opportunity comes up. We want to make sure that you can get all of that data together in a easy, digestible manner and be able to present it back out in a way that looks good, is accurate, and gets the information you need to the different entities you're working with. So I think that kind of launches us into our dashboard solution and kind of why we brought that to market and what it can do for you guys as an FQHC.
Thank you, Bailey. Yeah, it's not only the annual reporting requirement, but also the opportunity to, on a week by week, month by month basis, I identify maybe measures or trends heading in the wrong direction, and have the opportunity to make some corrections as we go. I think Darline is going to talk to that a little bit later. Okay, so UDS reporting. We stole a page out of the HRSA manual. This should look familiar to you. We're going to go into the dashboard and we're going to pull out in the demo some of the views, specific to the tables within this listing here across clinical quality measures, services rendered, and then some of the patient profile views. So before we go to the demo, full disclosure here, due to scheduling, we recorded this separately with Jim and Meredith. So let's play the video, and then we come back. We'll go to Darline to talk about how health centers can leverage this data to help inform their decisions and priorities.
Hi, I'm Meredith McKay, a healthcare consultant here at Medical Advantage. I'm joined by Jim Stevens, our Director of Informatics. Welcome, Jim.
Hi, Meredith.
We're going to take you through a few dashboard views aligned with FQHC UDS reporting categories. Jim, how about if we start in the clinical category with quality of care measures?
All right, so we have a dashboard that does show you your performance on a variety of quality measures. There's a dashboard that gives you kind of an overall view of how you're doing against benchmarks or against targets that you set. And we're also able to drill down into specific measures or measure groups as are needed for your enterprise. So right now we're looking at the HEDIS measures, and they're grouped by the NCQA grouping categories that are available. But we're able to look and see what is our performance overall, like we're looking at, or if I want to see how am I doing only on my child prevention and child prevention screening measures. When I click that, you can see everything filters, and it filters down to show only my performance on those measures. I also have at the top of the screen the ability to filter down to a specific provider or to a specific location if you have a multi-location practice group, or if I want to look for more detail on a specific measure or on a specific group of measures. The measures and the measure groups, the providers, and then the locations, those are all configurable drop downs. So if that's not how you choose to look at your data or split your data, as long as it's supplied and it supports it, we can configure these any way you want. Or if you have measure groups that aren't specifically the NCQA measure groups, and you are looking at, for instance, UDS grouping and what those measures are and how am I performing on that, we can add that as a group that you can then filter down to.
That's excellent. Thank you, Jim. Why don't we move on to a financial example, specifically services rendered? The typical summary of procedures, tests, etc., provided by the FQHC.
Okay, so if we're looking at a financial performance grouping, we have a tab for services, and we can actually drill down into what services are driving our performance. We can look at the services again. We can look at the services over time, so we can see, the number of services and the charges over time, how we're doing, what's the average number of services we perform per day, or the total services over this time period that we're looking at. In this case, we can filter down to any time period that you want to look at, and all the charts update, so you can zero down to the day if that's your granularity. Here we have the ability to filter down to a specific practitioner or a group or a location, whatever you select. These are configurable. We happen to have a grouping of visit types here too, so if that's applicable, that's something that we're able to do, and we're able to see the services that have been performed. And this chart is showing us services versus charges, so we can see what services are driving charges by the number of services being done versus the more expensive services that occur less but are driving revenue. All of it, again, like we saw in the previous one, all of the charts and views are interactive. So when I click on something, if I'm just looking now at diagnostic radiology, I can see what those top services are by revenue or by number of patients, and all the charts update when I filter down like that.
Well, thank you, Jim. That was wonderful. We have time for one more view. Another UDS category is patient information. For example, concentration by zip code, age, gender. Can you show us this view?
Sure. Our financial dashboard demo groups is looking at what's driving the revenue for a practice or a practice group. And one of the things that we know drives that is the patients. Where are the patients coming from? What is their demographic mix? What services are they? And we already looked at services, what services are being provided. But if we look at the patients and the patient mix, what the demographics are, we can see a mix of what the patients for this demo practice are: adult, child, so age group. We can see them by age group. We can see them by gender. We have them over time. Do we have an increase or a decrease of patients by age group over a certain time period? And again, like we saw in the previous dashboard, everything is filterable, so we can filter down to whatever date range we're looking at that's applicable. We also look at what patients, what insurer the patients are carrying. So what insurers are driving a lot of your revenue or your patients bringing to your practice. And the other thing we're able to do is drill down into the patient's address and see where they're located in reference to your practice, or get a listing of the patients by zip code or counts by zip code, if that's what you need.
Jem, that was great. Thank you very much. Thank you for your time today. I really appreciate it. There are a lot of different dashboard views we can customize. So if you didn't see what you were looking for today, as always, reach out to Medical Advantage and we can discuss your needs. And with that, we will get back to our webinar. Thank you, everyone.
Thank you.
Okay, so we're back. Now, Darlene, let's go to you. I'd be interested to hear your perspective on this.
Thank you. I'm going to back up a little and say, you know, it's clear that where we've come in terms of data visualization and our technology is really impressive in terms of, you know, healthcare data analytics and reporting. I think a piece that we often skip over is the process that it takes and the work, you know, behind the scenes to get to the dashboards and the views that Jim and Meredith walked us through. But I would do us a disservice by not actually mentioning, and you've probably heard it from your analysts, you know, daily, if not weekly, that there's a lot of work that goes into extracting the necessary data from the multiple data sources and systems, you know, running the quality control checks and the quality assurance, making sure things tick and tie, getting all the data to the right place, and then the work of calculating the metrics that you want to report and track over time. So that in and of itself is no easy feat, and that's usually hidden behind the data visualization and the reporting. But we don't want to skip on you know, the efficiencies that would come to the organization by using you know, a platform that takes that burden away from you all, so that, you know, frankly, you can move to the next step, you know. And I like to say that reporting is necessary, but not sufficient to achieving our overall performance goals. So when you think about why create dashboards, why create reports, you know, we're doing it because we want to measure and proactively track key performance indicators ahead of when they are due, ahead of when our granting agencies and our payers assess our performance. Because frankly, if we wait until performance measurement time, we're going to leave money on the table, right? We won't be able to have time to identify something that is trending in the wrong direction, something that doesn't appear to be on track. And here's where our solution differs quite a bit from, you know, typical analytics solutions in the market. Again, the technology is necessary, but in and of itself doesn't help you achieve your performance metrics. What do I mean by that? So we take all the work of getting the data together and making sure the quality is there and the metrics make sense, but we also take the time to investigate and look at metrics that are not on track or don't appear to be on track. And we have healthcare consultants that are behind the scenes who not only know healthcare data, but are really experts in quality metrics and the specifications and the detail on, what needs to be coded and where it needs to be coded in order to get credit for those metrics. And so when you have a refresh of your metrics, you also have a healthcare consultant proficient in these metrics that has identified potential areas of concern, investigated what potentially could be driving a dip in the metric, in essence, to save you time so that you don't look at the report and then just wonder what's off track. We're going to proactively identify some factors that may be driving those metrics. So, and we do that because we understand that delivery of a report should be really the beginning of managing financial metrics, quality metrics, and clinical metrics in the practice. So the report and the visualization is the beginning of your ongoing CQI processes.
Very good. And Bailey, I know we were talking just a minute ago about just a recent example, maybe just to build on what Darline was just saying, if you could share some of the details of the current project you're in the middle of.
Sure, no problem. So we have been working with an FQHC in one of the southern states. I'll keep it vague, keep their confidentiality there. They really came to us originally asking about their EHR and not getting the data they were hoping to out of it, thinking they were putting in all the good work, right? They were seeing patients correctly, thought they were entering all the data in the right places, but at the end of the day, they weren't seeing that pushed back out in the reports out of their EHR. So we started our conversation there, but quickly learned that they had several grants, which those metrics that they were reporting out for weren't consistent with the work that was being done. So we kind of switched lanes. They were very interested in the dashboarding product. So a combination of things will probably happen there. We'll probably help them with their workflows and mapping of the background data of what's happening within the EHR. So taking a peek at, how LOINC codes are mapped and a lot of other fun stuff that I won't bore you with, but we'll do that process. And then we'll also bring them into the dashboarding solution. They're wanting to bring in their claims data as well, comparatively, their EHR data and some of their financial data that lives outside of the EHR. So those three combined areas are going to be brought into our dashboarding solution, and it's really going to give them a clear picture of a lot of different things, but they'll be able to report out for their grants with this, be able to update the team on a quarterly or a monthly basis, depending on when their meetings fall, of how they're doing, what needs to shift or change, kind of like Darline mentioned. And we'll be able to help them along the way to point out areas where there is opportunity for improvement, and also help them kind of solidify any changes that need to happen, either workflow wise or within the use of their various systems to get them where they need to be.
Okay, fantastic. Why don't we segue over and take some questions? I see we've got a couple questions that have come in. So here we go. The first one here, let's see. We have next gen. Are you able to work with any EHR is sort of the first bit. And then we also feel like our claims data doesn't always match the work we're doing. So this is like right aligned with your example, Bailey. Is that something that dashboards might be able to help us with?
So I think the simple answer from my side is yes, we can help you with these problems with the dashboard. We do work with a variety of EHRs and data sources in general, so that's nothing that we are afraid of or haven't done before. Give us your EHR and we've probably made a solution for our dashboards with that. But Darline might have a little bit of additional insight there to share.
Yeah, thank you, Bailey. I agree. Any EHR is fair game when it comes to payer data. Payer data is complex, but we have a robust all-payer data warehouse and quite a bit of experience in cleaning data from payers to stage it for analytics and reporting. And so that indeed is something that we can do.
Okay, the next one is around pricing. For the dashboard, we saw in the demo for the consulting services that Darline was mentioning, how is it all priced?
Sure, I can definitely take an initial run at that. So we start our solution at a very reasonable price that we wanted to kind of be attainable for everyone. It starts at $29.99 per month. So you'll have a monthly fee, and that's going to include the build of your dashboards. It's also going to include some analytics hours in there, so that you're going to have some of that service that Darlene explained just built in with your monthly fee. So that's really nice. It's not an additional fee for those services, and we are able to help with a variety of problems rolling out of there that we can discuss. If you're interested in kind of knowing customized, what your organization needs, we're always happy to walk through and create a quote specifically for your organizational needs. So feel free to reach out. There'll be, I'm sure, a quick slide at the end of this webinar for you to take a look at, but I'm happy to walk you through and talk through your specific needs at a later time, and we'll get you rolling on what pricing will look like.
Great, and Darlene, I know you were driving a lot of the solution design of this, so I'd be interested in your perspective around, there's no shortage of mega dashboard solutions in our industry, and I think we were very deliberate in targeting a different segment of the market with pricing accordingly.
That's indeed true. We have worked with solutions that are anywhere from $1 million a year to $5 million a year. As a public health professional, it was clear that the smaller practices and the ones doing really critical safety net work in our communities could not leverage the benefit of those solutions. We feel really strongly that taking advantage of the technology and the analytics that are available in this day and age should be open and available to FQHCs, to public clinics, to smaller physician practices. And so we designed our solution with that in mind. We didn't over design, and we didn't skip on the data visualization and the components. So with that said, we tailor based on your practice needs. So if a practice basically has no reporting, we will get you started with some, pop health and clinical and financial and operational metrics that we have already built for customers. And then on the other extreme, if a client really has a robust set of reporting but is looking for efficiency, so they can, free up some time of their critical analysts that really know the business, we can customize the solution to match their current reporting needs. So anywhere in between, and still maintain the affordable nature of the product.
Okay, very good. So let's take a look, Josh, if you can put the next slide up. Let's let folks know where they can go for more information. Bailey's contact information is there. I would also like to mention the blog and insights section of the Medical Advantage website. We've got any number of different articles. We've got recordings of prior webinars such as this. We earlier this year launched the Medical Advantage podcast. So depending on how you like to consume your content, we've got a lot there for you. We tend to promote these kinds of sessions through our social channels. So please, if you haven't already, like and follow us, LinkedIn, Facebook. So with that, I think that that wraps us up. Bailey, Darlene, great job. Thank you, as always, for helping out today. And for you, our audience, let me mention one quick thing. As soon as we wrap up here today, you'll see a survey that comes up on your screen. If you could please just give us a minute, we would really appreciate your feedback. These are just simple point-and-click responses, but we'd love to hear from you. So with that, thank you all for joining us here today. We hope you found the session helpful and useful, and we hope to see you again at a session in the future. Thanks a lot. Bye, everyone.
Thank you.